I'm Dr. Linda Saycon. I am the chair for the Department of Physician Assistant Studies, and today I'm going to be interviewing Professor Jay Peterson, who is a physician assistant and also a longtime PA educator. So, Professor Peterson, tell us a little bit about yourself and your role.
Sure, thank you, Dr. Saycon. I am a physician assistant. I've been a PA since 2003, and I've worked clinically in orthopedic surgery and sports medicine, both in the hospital setting and in a private practice. And as she mentioned, I am a PA educator. I'm the assistant program director here in the Department of Physician Assistant Studies at High Point University, and I've taught in a couple other PA programs before that.
So, as a PA, how would you describe your role on the healthcare team?
That's a great question. And I do view it as a team. So I work clinically in sports medicine, orthopedic surgery, and I work along with physicians, work along with athletic trainers, physical therapists, and so on. As a PA, I diagnose and treat patients. So I will perform histories and physicals, order tests, interpret those tests, and then try to develop like a management plan, prescribe medications, and so on.
So, as your role as an educator, can you provide some insight to how PAs are educated?
Yeah, it's a great question. So PAs are at the master degree level. Typically it's a 27-month program, and we cover all different areas of medicine, focusing mostly on what we call primary care medicine. And we will guide students through this both in the classroom or didactic setting, and then also on clinical rotations during that time.
So, as a PA educator and also a practicing PA, what does practicing at the full scope of your license look like?
I see. So PAs work in every different specialty in just about every setting in medicine. So it can be a little bit different depending on what the setting is. But typically it would mean that the PA would be a valuable part of the healthcare team. They would be making some autonomous decisions and then working with the healthcare team to kind of implement those. So I think the practicing to the full scope would definitely be that the PA is seeing patients kind of on their own, but then working with the healthcare team to help the patient the best they can.
So within that realm, what would you say the advantage is in healthcare to your ability to be able to practice to the full scope?
I think the main thing is that the PA can help the patient just as the other providers and members of the healthcare team can do. Practicing the full scope is using everyone kind of efficiently in that healthcare team.
Do you see any barriers to that happening?
I think a lot of the barriers have gone down in recent years. I do think that there are in some states, there are some barriers to PAs working fully, and there are occasionally some barriers in hospital settings, some rules or regulations that may limit what the PA could do in a certain setting.
Okay, so in closing, what do you like most about being a PA?
I really enjoy interacting with patients, so I love that the patient interaction that I get to have as a PA. To me, it's a lot of responsibility as far as medical decision making, which I enjoy. And then working as part of the healthcare team, I think the PA fits very nicely within the team type setting. So a lot of things.
So thank you so much for helping us out today.
All right, thank you.